All right, guys. So now let's talk about the last part, which is the nasal cavity. So for the nasal cavity, super important, we are going to go over the different parts. So we're going to start with the most external structure, which is the nose. And as you can see on this picture, the nose has typically more of a pyramidal in shape, but it changes between uh, every ancestry or lineage that you may have. The shape of the nose can change between, different ancestries. So for example, in this particular case, you can observe, but typically you can observe that the root, it's the upper end of the nose, continues with the forehead, versus the dorsum that extends from the apex to the midline, and the two apertures on each side, which we call the nares or nostrils. Each nostril is limited by an ala of the nose more laterally, and they are supported. The tip of the nose is more supported by this hyaline cartilage, which is why if you touch the tip of your nose, you can bend it. Now, for the cartilage, I'm gonna show you. I'm gonna make myself a little bit to disappear behind this PowerPoint, but you can see right here, right, that cartilage, that septal cartilage, the lateral cruise of that cartilage, and medial cruise of that cartilage. So this cartilaginous framework supports this lower part of the nose, and it has those three parts, like I said, the septal, alar, and alar cartilages. Um, Now, for the nasal cavity is just a chamber that has a bony part and a cartilaginous wall covered with mucosa. And in this particular case, this is a sagittal section of the face where you can see that nasal vestibule, for example, which is this immediate area above the nares that allows the entry here into the nasal cavity. The nasal cavity has a floor, a roof, and two lateral walls, and a midline partition, which is the nasal septum, nasal, not nasal, nasal septum, dividing the cavity into a right and left part. So in here, this picture is just showing you a coronal section through the skull to show you that relationship of the nasal cavity and the orbits, right? So you can observe right here also the sinuses as well. But this right here in general, more medially, it's the nasal cavity. Now, the nasal cavity has several functions, very, very important functions, such as in the production, sorry, such as in the detection of olfaction, right, for olfaction or smelling. It's conditioning of inspired air, so it allows you to filtrate, humidify, and warm the air that we're breathing in. And it's the reception of secretions from the paranasal sinuses, right, such as like mucus, etc. So that's where those are produced. So it has a very important function. Also, it's not written here, but it also allows you to, it helps you in the process of phonation, right? When you're speaking, it allows you to, it helps you in the process of phonation. So some of the relationships of the nasal cavity include a more superior lateral and upper and lower parts. So for the superior part, we have to look at the anterior cranial fossa, which you can see right here more superiorly, which is separated by the cribriform plate. More lateral to upper parts of the nasal cavity, you have the ethmoidal air cells, which you can observe here on this picture, this coronal section. And lateral to lower, you have to think of the maxillary sinuses, which are over here more inferior. Um, Now, on the inferior aspect, you have the oral cavity separated by the hard palate. So actually, the hard palate is what forms the floor of the nasal cavity. And then posteriorly, you have to think of the nasopharynx communicating with the choana. So again, the floor, like I said, is the hard palate based on the maxilla and horizontal plates of the palatine bones. The roof, it's going to be the nasal bone, nasal spine of the frontal bone, cribriform plate of the ethmoid bone. You have the anterior and inferior aspects of the body of the sphenoid as well, forming the roof of the floor. Now the medial walls, you have the nasal septum, perpendicular, specifically that perpendicular plate of the ethmoid and vomer bones. And you have some very small contributions by the sphenoid, maxilla, and palatine bones, but very small. And then the lateral walls, you have the maxilla, lacrimal bone, inferior nasal concha, you have the ethmoidal labyrinth, you have the perpendicular plate of the palatine bone, and the medial pterygoid plate. So in this picture, you can observe that vomerine groove. You can see this nasopalatine nerve, where the nasopalatine nerve and vessels can pass. But anyways, I'm digressing. This is just the vomer. Perpendicular plate right here of the ethmoid bone and the septal cartilage more anteriorly. And also, as part of the compositions of the wall, you have three scroll-like bony projections, which we call the superior, middle, and inferior nasal concha. And I do have a picture here. You can observe that superior nasal concha, middle nasal concha, and inferior nasal concha, which is also deep to that tissue. You have a specific bone by itself, which is inferior nasal concha, or that bone. Um, like I said, it's a separate bone. So the space inferior to each concha we call the meatus, and so there's three meatuses: a superior nasal meatus, middle nasal meatus, and inferior nasal meatus. Which, if I go back, well, actually, I can show it to you in this picture. So you can see here the superior nasal meatus, middle nasal meatus, and inferior nasal meatus. Okay. Now, let's talk about the innervation, because this is super important. Now, for general sensory nerve supply, we have branches of the ophthalmic and maxillary nerves. You also have anterior ethmoidal nerves, posterior lateral nasal branches, supplying the mucosa of the posterior part of the lateral wall, and nasopalatine nerves, which are supplying the mucosa of the posterior part of the nasal septum. Now, with every special sense, they're going to have their own special sensory nerve supply. In this particular case, is going to be olfactory nerve receptors off of that olfactory nerve, cranial nerve number 1. And so these are going to be branches, right, or receptor cells of this nerve, which are bipolar neurons located in that olfactory mucosa. I'm going to show you here. These are those branches. Here, if we zoom in into that olfactory epithelium, you can observe those cells. Those are olfactory receptor cells with the olfactory receptor cilia, right? And in between those olfactory cells, you have the supporting cells and more immature receptor cells and basal cells, right? So essentially, those are passing through the openings of the cribriform plate, and they are ending in that olfactory bulb. And that olfactory bulb is what eventually continues into the olfactory tract, and that's going to be considered cranial nerve number 1. Now, also, if we talk about innervation, we have to talk about arteries and veins, so blood supply. So for the arteries, mainly it's going to be the sphenopalatine and anterior ethmoidal arteries. Sphenopalatine, it's a terminal branch of the maxillary artery, which supplies the posterior part of the lateral wall and septum. And the anterior ethmoidal artery, which is a branch of the ophthalmic artery, supplying the anterior parts of the lateral wall and septum. And then on the anterior part, this is very important, you guys. The anterior part of the nasal septum, right? You have these branches that are kind of like colliding or anastomosing in a little area that we call the Kieselbach's area. And so it's a combination of septal branches of the sphenopalatine arteries, greater palatine, anterior ethmoidal, and superior labial arteries, anastomosing with each other and forming that area, which is why if someone suffers an accident on that area, It's a very common site for nosebleed, also known as epistaxis. Okay, and so the veins are in that area, which what we call it's by the pterygoid venous plexus. Also, each one of these arteries have a very similar name for their veins as well. So here you can see a picture of the anterior ethmoidal artery, the sphenopalatine artery, and then you can see more anteriorly on this picture the Caselbach's area that I just mentioned. All right. Another very important structures that are related to this area of the face is the paranasal sinuses. And so these sinuses are spaces in the frontal bone, maxilla, ethmoid, and sphenoid bones. And they are going to be lined by a mucosal membrane that is continuous with that nasal cavity. And so that is why we end up with what we call a frontal sinus. We have two of them, frontal sinuses, ethmoidal air cells. We have the maxillary sinuses and sphenoidal sinuses. So these sinuses develop more as evaginations of the nasal mucosa. And at birth, those are going to be very rudimentary, but as you continue growing, they continue expanding and growing and becoming the sinuses whenever we are adults. And so the functions of these sinuses are super important because they work in resonating chambers for voice, and they lighten the skull bones particularly. So those are some of the most important functions of the sinuses. So in general, the relationships, the superior relationship is going to be the orbit and its contents, right? So your orbits. Your medial relationship is going to be the nasal cavity. The inferior relationship is going to be the root of the maxillary teeth. And the nerve supply for the sinuses typically is going to be the superior alveolar nerves from V2 or trigeminal branch 2. And then your blood supply, it's going to be the superior alveolar arteries. Here's a little bit more information on each one of those sinuses. For example, for the frontal sinuses, which you can observe here more superiorly, located within the frontal bone behind the superciliary arches. And the ethmoidal air cells, which we can observe whenever you do a dissection of the orbit from a superior angle, you can observe more immediately those ethmoidal air cells if you are able to break a little bit more medial on that cribriform plate. So those ethmoidal air cells are very thin wall spaces within the ethmoidal labyrinth, and we have between 3 to 18 total of ethmoidal air cells. And the nerve supply is the anterior and posterior ethmoidal nerves, which are branches of the nasociliary nerve, and the blood supply is the anterior and posterior ethmoidal arteries, branches of the ophthalmic artery, excuse me. And then the sphenoidal sinus, which is more posterior. If you notice, more posterior and inferior to the pituitary gland in anatomical location. So located within the body of the sphenoid. And the nerve supply is going to be posterior ethmoidal nerve, and blood supply posterior ethmoidal artery. Last but not least, here's our clinical correlations for the day. I did talk about the nosebleed or epistaxis, which typically the causes are nose blowing, like if you blow your nose too hard, over enthusiastic nose picking, like those little kids, or direct trauma, right? Like somebody got punched, or like those people in like kickboxing or any type of boxing situation, right? That Caselbach's plexus can be definitely affected, and a person can bleed a lot, right? Like way too much blood. Now, for sinusitis, this is an inflammation of those sinuses that we just talked about, typically due to viral upper respiratory infection or bacterial upper respiratory infection causing blockage, right, or inflamming the sinuses, all right? And that's pretty much it for this video. Thank you so much for watching, and I see you on the next one.